Hello, I'm Dr. James Gray, a retired obstetrician gynecologist and secretary of the Upper Cumberland Medical Society, the Tennessee Medical Association's affiliate medical society for the 14 counties of Upper Cumberland. The United States is adding 64 new cases of COVID per 100,000 residents every day. Tennessee is adding 122 cases per 100,000 per day. The Upper Cumberland region is adding 165 cases per 100,000 per day. And we happen to be the highest rate of all the regions in Tennessee. To start off with, you had very few cases in Warren County until the 4th of July weekend, at which time you had a surge up to about 30 cases per 100,000 per day as of August the 13th, at which time County Executive Jimmy Haley issued a mask mandate. You had a very nice decline in your rate down to 12 cases per 100,000 per day by the end of September. Then you entered the fall surge, and especially at 1st of November, it went up until, as predicted, Thanksgiving weekend, there was a shutdown in testing and reporting. And so there was a decline in testing and reporting, but cases were being spread throughout the region. And then when testing and reporting resumed, you found yourself in the middle of the post-Thanksgiving surge as predicted. This shows the intensive care capacity for the Upper Cumberland region and for McMinnville. You're lucky in McMinnville that you at least have one of the three hospitals that has any ICU beds at all, but you only have 8 ICU beds, and I'm sure they're all full now. Cookville Regional only had 48, and I'm sure they're all full now. And Cumberland County Medical Center was in Crossville was already full December the 4th, which is the last date with statistics available from the new federal database keeping up with hospitalizations due to COVID. I wanted to let some of our doctors speak, and one of the Dr. Brent Stanton. I'm afraid over Christmas there really is no room in the inn for people with severe COVID, and about all that our hospitals can do is to send people home on oxygen, steroids, and prayer. And that is a treatment Dr. Brent Stanton is getting now. He was unable to join our Zoom meeting because he was too sick, but he did make a pet podcast just a few days previously, and he asked me to play this excerpt for you about what he feels that people can do to get this under control.
Not been wearing a mask, get it out. Get a N95 mask if you can. Get a double cotton mask if you can. Get the best mask you can to fit your face. Protect your neighbors, protect your loved ones, protect your children, because you don't know in 10 years if your child gets COVID-19 today, whether they're going to have pulmonary fibrosis in 10 or 20 years or not, especially if they pick up smoking or vaping. We don't know the long-term outcomes to our kids. So love your children, love your neighbors, love your family, and love your nation. Let's double down and protect ourselves. Thank you very much for having me to talk today. I really appreciate it. And if this saves one life, it's worth my time. I'm fortunately sitting here on 3 liters of oxygen so I can have this conversation. This is real. So it's our nation at stake. This is the United States of America. There's nothing we can't do if we do it right and we do it together.
And these ICUs need to be available for the conditions they were built for young people that may be in auto accidents, that have a flailed chest, and have a great chance for recovery. And we're getting to the point now where we're just not going to be able to give everybody a bed, and there's no place to refer them to because the major cities are all filling up too. But they'll have to send them home on portable oxygen, steroids, and prayer. And that's about all that we can offer them. And the death rates will go up. We have monoclonal antibody available. This is can be given early on to prevent these serious complications. And we also have vaccines coming. But all of our healthcare providers are overwhelmed with people who are super sick. And we really need help in curtailing this. It doesn't have to be that way. It could have been prevented if only everyone would wear a mask to prevent the spread of this virus.
I'm Dr. Dawn Barlow. I am the president of the Upper Cumberland Medical Society. I'm an internal medicine physician in Livingston. And I want to take a moment to encourage everyone in the community to wear a mask and to social distance and to make sure you're using proper hygiene. We are seeing an uptick in the number of COVID cases in the Upper Cumberland. We're also seeing an uptick in the number of people who are sick enough to require hospitalizations. And we're seeing our friends, families, family members, neighbors continue to get very sick and die with this disease. We need everyone on board participating with masking, social distancing, and it's so important that every person in the community do their part so that we can get a hold of this infection and get it under control. We are also encouraging, when the vaccine is available, that everyone participate and get vaccinated when the time comes.
Thank you for having me, Dr. Gray. It's not really rocket science. As you've already said, we have the vaccines on the way. We know that it's going to be months and months and months before we really have the immunity from these vaccines. They're just not going to work instantly. We're so glad we're having them, and this is something we really need, but we've got to do something in the meantime. And as we've said many, many times, or as I've said many, many times, this is just not really rocket science. Face masks, just very simple face masks. Studies have shown that we can reduce the rate of infection by 80% if we just had universal masks, if people would just cover their face, their nose, and their mouth. The reason why is because this is an airborne virus, and that's the way it's mainly spread. Now, obviously there's other things that we need to do too, but I'm a big proponent of the mask being probably the most important thing to stop.
Earlier, you told me about an experience that you had with this virus firsthand. Would you mind just repeating that?
I was in a closed environment with someone that was asymptomatic, and they did not wear a mask. I had a mask on, didn't have an N95 mask, but I had just a regular mask on. Did all the measures that I was supposed to, tried to stay my 6 feet apart, did the hand sanitizing, and after about 3 days later, I got a call from the public health department that the person that was totally asymptomatic, the gentleman was, and he tested positive. And that afternoon, I began to run a fever, and it went downhill from there. And I still have lung damage associated with that. That's probably most likely going to be permanent.
Thank you.
As Dr. Duke said, this is a respiratory virus, and prevention is simple. It's not rocket science. It's simple. Wear a mask and just use basic hand washing. Distance yourself when possible. That's easy. So my office has not closed, like most primary care offices. And we wear masks. We have a mask mandate in the office. Anyone in the building has a mask on. Certainly healthcare personnel are not immune. Dr. Duke had an experience with it. We've had several members, several rural physicians in the Upper Cumberland and a little wider area succumb to this. Dr. Staten, with whom I work closely, he's struggling. He's had all the treatment there is. I mean, the whatever's recommended that's out there has been available in our region, which is wonderful. And he has had that treatment, but he is still struggling, still on oxygen, and we don't know what the outcome is going to be. We know that 80% of people roughly who contract this virus will be fine. They'll essentially shake it off, as some of my patients say. But 1 in 5, 20% of people don't. And of those 20%, about a quarter of them are going to get severely ill and be hospitalized. And that is where the problem lies. And we can't predict who.
The message that we're all saying is please, please, everybody wear a mask when you're out in public with people that don't live in your household. Set an example for everybody. Limit your holiday gatherings to people that live in your household. It's not time to ask grandma and grandpa to go visit this year or to go to their house. They need to stay in their own house if you want to have Christmas with them next year, and keep a distance between yourself and others. And we need to ask everybody to do this, please, because we need our healthcare providers. We need people like Dr. Staten. We need all of those ICU beds in McMinnville to be available for when there's auto accidents or other things that we have short needs for ICU beds. Anyway, that's our message. Yeah, Ty, go ahead.
If I can just say one more thing, we've said this: prevention is simple, treatment is complex, but the real complexity here is attitudes. And so in America, when you look at a world map, America is doing the worst of all nations in the world, essentially. And if you look at one characteristic of America, if you ask anybody in this country, what is a characteristic of America, one defining characteristic? And I've done this before over the years. The answer is one word: it's freedom. It's freedom. We want our freedom. We want to be able to do what we want to do when we want to do it. Well, there was a notable scholar and speaker by the name of Os Guinness, who several years ago gave a presentation, and he said, the number one enemy of freedom, and he paused. He asked the question, does anybody know what the number one enemy of freedom is? And the answer is freedom. And this pandemic is proving it. We are currently our own worst enemy, because instead of protecting and loving one another, we are wanting our own freedom to do what we want to do when we want to do it. So I'll come back to the message that we've all stated: prevention is simple. Please wear a mask.
Thank you.
I think what it comes down to, as an American nation, we need to refocus on unity and protecting one another. And I'm sure everybody out there listening probably will understand this. You love God and you love your neighbor. Unfortunately, not only did I contract COVID-19, but I also contracted type B flu as well, and I have an underlying asthma. I contracted type B flu because we're short on flu vaccines in our area whenever I needed one. I had one left in my office, and a patient comes in with hypertension and diabetes. I chose to give the flu shot to the patient, not myself, because they needed the protection, because I didn't want them to end up having flu and COVID at the same time. As family medicine physicians and as doctors as a whole, and as healthcare providers and frontline workers, our number one goal is to serve patients. We don't want to be heroes. We're a servant community. We don't do this for glory. We don't do this to be called heroes. We do this to serve. That's it. And we can serve our patients much better if they would assist us by protecting themselves, which then in turn protects us. We've had patients lose limbs. The things that we're not talking about in this, there's disabilities associated with this post-COVID. So if you don't have symptoms today, you don't know what your symptoms are going to be 10 years from now. We're going to have to get back to the point to where we can trust our doctors, where we can trust our scientists. We can't continue down a pathway of distrust. My patients who have died of COVID would not be dead today. And people who don't believe this is a pandemic, I'm not sure where they got their medical training from. I'm not sure where they got their master's degree in health policy from, but I think it's pretty simple to look up the word pandemic and see that this is a pandemic. This year we've lost already 300,000 Americans, and I'm telling you, looking at data, if we don't move faster on this vaccine, people are going to go have Christmas, and the same thing is going to happen after Christmas. That's happened after Thanksgiving. People are going to go to New Year's parties, and the same surges are going to happen after New Year's that happen after Thanksgiving. And we're going to have more and more deaths. And we're going to have record deaths. 3,000 people died in a day so people could go have Thanksgiving dinner. So we need to redouble our focus on mask wearing. And when I say mask wearing, wear the appropriate masks. Wear your masks correctly. Don't wear it under your nose. Don't wear it under your chin. Wear it up on your face. Cover your nose to your chin. Tighten around your face. Make sure you protect your family at least. If you're not worried about other individuals in your community, at least be selfish and take care of yourself. Because by retrospect, if you do that, then you're taking care of everyone else. So I'm here to tell you, this is no joke. This is serious. This is killing people. It's wearing me out, fellas. We're about there. We got it. I can do it. We got it, man. People want to live a normal life. Okay, living a normal life right now is wearing a mask until we can get vaccinated. And if you're not willing to wear a mask, then stay home. Talk to your physician if you have COVID-19 about your treatment plan, if you need to talk to them every single day. Our number one goal is just service. Our number one goal is to love our patients. That's all we do. That's all we want to do. All you have to do is go back to the basics to mitigate spread. Wash your hands, social distance, love your neighbor, wear a mask appropriately, and take care of your health. As we know, suicide rates, drug use, alcohol use, domestic violence, child abuse, all of these things are on the rise during this very stressful time. But most importantly, we now have a weapon in our war. Now that we have a weapon in our war, that's not, quote, just a mask. Please wear your mask now. This is the perfect time. If you've not been wearing a mask, get it out. Get a N95 mask if you can. Get a double cotton mask if you can. Get the best mask you can to fit your face. Protect your neighbors, protect your loved ones, protect your children. We don't know the long-term outcomes to our kids. So love your children, love your neighbors, love your family, and love your nation. Thank you very much for having me to talk today.